Hi everyone, my name is Montana Thursby and I'm a nursing student passionate about maternal health. Today I want to talk to you about a group that often goes unheard, pregnant teens in our local schools, and how we can support them in a way that truly makes a difference. This isn't just a health issue, it's an education issue, it's a social equity issue, and it's a community issue. Here in Quincy, we know teen pregnancy exists in our schools, but we don't always talk about it. In Illinois, roughly 1 in 20 girls aged 15 to 19 becomes pregnant each year. That's not a small number. In a rural or small town communities like ours, those students often feel invisible, unsupported, or worse, judged. Teen moms face not only the physical demands of pregnancy, but also overwhelming social stigma. They often are isolated from their peers, overlooked by staff, and left to figure out adult responsibilities with little guidance. So I ask you again, what are we really doing to support them? This is where doulas come in. A doula is a trained, non-medical professional who provides emotional, physical, and informational support before, during, and after childbirth. Think of them as a constant presence, not someone who checks in and out of a room, but someone who is there entirely for the birthing person. Unlike doctors or nurses who have multiple clinical responsibilities, a doula's job is singular, to offer continuous, personalized support to the birthing person. And that matters, especially for teens who might be experiencing labor without family support or while feeling completely underprepared. The research backs this up. A landmark review by Bowen et al. 2017 found that having a doula present reduces the likelihood of cesarean births by up to 39%, decreases the need for pain medication, and leads to shorter labor. Those benefits are crucial for anyone, but even more so for teenagers whose bodies are still developing and who may already be at increased risk for complications. Beyond medical outcomes, doulas offer dignity. They reduce trauma. They give young moms a voice during one of the most vulnerable moments of their lives. But there's more. Doula support doesn't end in the delivery room. Teen moms with doula support are more likely to return to school and graduate. One study showed that teens with structured support like doulas were significantly more likely to complete their education. Why? Because when someone is there to help them navigate postpartum challenges like breastfeeding, healing, infant care, and mental health, they're not forced to choose between being a student and being a mom. They get to be both. For a 17-year-old, that support could mean the difference between finishing high school or dropping out entirely, between staying on public assistance or building a future. Now, let's talk about costs, because I know people ask, how do we pay for this? How much is this? The answer is, we can't afford not to. Community-based doula programs have been shown to be cost-effective. By reducing preterm births and the need for expensive NICU stays, these programs save taxpayer money. According to studies, every dollar spent on doula care saves approximately $5.34 in medical costs and public assistance later on. And these aren't luxury services. In fact, Medicaid in some states already covers doula care because the cost-benefit ratio is so strong. Think about it. Investing in one certified doula for our school district could prevent thousands of dollars in preventable healthcare costs, and more importantly, offer priceless support to our most vulnerable students. I want to bring this closer to home with a real voice from the field. A young mom from a similar school-based doula program once said, "My doula made me feel seen when everyone else ignored me. She helped me believe I could do this. She stayed after my baby was born to help me figure out how to keep going." That's the kind of care we're talking about. Not just clinical, but human. Grounded in empathy, patience, and belief in a young mother's potential, because they do have potential. This isn't just policy, it's people. It's about dignity, it's about equity, and it's about believing that no matter how young, no matter their background, every pregnant student in Quincy deserves the chance to be supported, not shamed. We say we care about our students. We say we want them to succeed. Well, success starts here. It starts with being seen. It starts with support during the most physically and emotionally demanding chapter of their young lives. So, what can we do? You can help advocate for a certified doula program in Quincy Public Schools. This doesn't have to be a huge bureaucratic process. It can start small with a pilot program, with a grant application, or with one passionate staff member stepping up to lead. You can email the school board. You can talk to local maternal health organizations. You can start a conversation at your dinner table, in your student group, with your children if you have them, or even with your peers in healthcare. You can also advocate at the state level to push for Illinois Medicaid expansion to include doulas in school-based settings. Because when you speak up, you make it possible for someone else to be heard. When you advocate, you're not just talking, you're transforming lives. Every single student deserves the chance to succeed. And sometimes success starts with the support in the living room. Sometimes success starts with someone believing in the person. Let's lead with empathy. Let's lead with action. Let's bring doulas into our schools. Thank you.